Thank you so much for being here this afternoon. I'm really pleased to be here today. I am going to just spend a very quick few minutes talking about the clinical side of things and what we've experienced here at UW. And then I'm going to turn it over to my partner, Dr. Gentile, to talk a little bit more about the research that's going on in our clinic. So as we mentioned before, we founded this clinic very early in the pandemic. We started this clinic in May of 2020, right in the height of the pandemic, recognizing that there were many people being affected by post-COVID condition. And this clinic is a multidisciplinary clinic, and we partner with our family medicine, internal medicine, primary care colleagues, neurologists, rehab psychologists, and a wide range of specialists who help participate in this clinic. So over the last few years, we have seen thousands of patients in the UW clinic. I don't have time today to talk about all of the treatments that we're using in the clinic, and I know that there's lots of questions about what the most effective treatments are. I would just like to say that we currently don't have any one single treatment that's most effective for long COVID, but all of the research that you're hearing about today and will hear about in subsequent talks helps to inform potential treatment strategies. So we've got a lot more information about the pathophysiology and the different subtypes of long COVID and how it's affecting people. And all of that research is helping us to come up with treatment strategies for our patients. So I'll just share very briefly, over the last few years that we've been seeing patients in the clinic, we've learned a lot of things that I think are important. You've heard that there are over 200 symptoms that people experience with long COVID, and the treatment, the course for patients is very unique. So there are many overlapping symptoms that people have, but nobody has the same course. And although we don't have any one particular treatment for long COVID yet, I do think it's coming. But we have many different treatment strategies that we have been using in the clinic, and we've been helping patients to get better. I think a couple of things that are really important to know, and that I tell my patients, that COVID is like lighter fluid; it sets everything on fire. So when people have underlying medical conditions, premorbid medical conditions, COVID can exacerbate those and can tip people over the edge if they have any predisposition to medical conditions. So we have to think about things holistically. We have to look at COVID and the after effects of COVID in the context of all of the other underlying medical conditions that people have, as well as all of the psychosocial issues that people are experiencing, because that all influences how people experience COVID. I mean, I think most importantly, what we've seen in the clinic, and you'll hear a little bit more about this, is that patients are frustrated out there, and there's a lot of disbelief among the medical community about the presence and severity of long COVID, and so there's a lot of relief from our patients when they come to see specialists who understand it and believe them and are able to help them manage their symptoms. So I think the access to specialists in long COVID is really important for patients and continues to be very important. We use a very holistic treatment approach in our clinic, and I won't go into details about this, but I do think it's important that we treat the whole person and that we look at all of the different factors that are associated with patient symptoms, and that's where we have really seen the biggest benefit. So we do focus on the whole person when we're treating patients. I do want to just mention something briefly about access to care, and we heard earlier that in Washington State, there's over 100,000 patients that are affected by long COVID. We in the clinic here have had up to 17 different physicians at any given time in our clinic seeing patients, and we've only seen several thousand patients over the last few years. So we know that we are just skimming the surface in terms of what the need is for specialty care in Washington State and throughout the WWAMI region. We also know from our data that we are missing a lot of patients in those high-risk categories. There are many patients from underserved communities and underrepresented populations that are also not represented in our clinic. And so in response to that, in our experience, we applied for funding through AHRQ to improve the access to care within our clinic and throughout the WWAMI region to specialists who have experience with long COVID. So we were one of 9 multidisciplinary clinics around the country that were awarded a 5-year grant to improve access to care for patients. Really the focus of this grant is to not only improve the delivery of care and access within our clinic at UW for patients throughout the WWAMI region, but also to do community outreach and to train primary care physicians and other clinicians throughout the WWAMI region to be able to better care for patients in their own communities. We are focusing specifically on populations including Native Alaskan, Native American, South Asian, Latinx, and LGBTQ, as well as rural patients through this grant. So a lot of great work going on in our clinic. I'll just highlight that this is a very large team of people who are working on this and a multidisciplinary team. So I want to thank everyone who's here. Many of our team members are here in the audience today. So I'm going to turn it over to Dr. Gentile. Okay, great.
So I'm going to talk just a little bit about 2 specific studies that are ongoing in our clinic right now, both of which are supported by internal royalty research fund grants, and both of which have the data that has come from these has gone into either the AHRQ award proposal and also clinical trial studies that are up and coming. The first one I'm going to talk about is a randomized controlled pilot trial that is using evidence-based self-management strategies. Specifically, our rehabilitation psychologists are leading this, and they're looking at the feasibility, acceptability, and preliminary efficacy of the intervention, which is 6 modules of group sessions where long COVID patients can actually come together and they are taught specific skills targeting 6 elements to help them with fatigue, breathlessness, memory and attention issues, as well as sleep issues, and stress and anxiety. So this data currently is being analyzed, and they're hoping to submit for a larger clinical trial grant in the near future. And I can say just anecdotally, several of my patients have participated in these group sessions, not as part of this study, but just out of our clinic, and have really found immense benefit and actually wish that these sessions went longer or that they could repeat them. The second study I will talk about is another mixed methods study that is led by myself and my colleague Chris Ma and research scientist Rachel Geyer. And here we looked at over 1,000 clinic intake surveys along with patient-reported outcome measures. And we did 7 focus groups with 25 patients. And altogether, we looked at the association pain may be having on quality of life and function, as well as patients' perception of the care that they're receiving for long COVID. We have a ton of results that came out of this, but I just want to highlight a few in response to some of the questions we received in advance of this symposium today. And that is that the majority of patients that we see are reporting moderate to severely impacted physical function, as well as fatigue. And there's a high level of depression, anxiety, and PTSD in patients with long COVID associated pain. What is even more remarkable, though, is that 9% of patients versus 0% of patients, 9% of patients with pain versus 0% without pain are actually reporting suicidal ideation or intrusive thoughts, which just highlights the importance of what the rehab psychology team is doing in the study that I mentioned before. We also received a question about workability before coming into this. And so I wanted to highlight that almost half of the patients that we're seeing are at moderate to high risk of prolonged pain and disability. And 81% of all the patients that we've seen in our clinic, so that's out of the thousands of patients that we've actually seen, are actually reporting that they are unable to work at the same capacity that they did before they had COVID. So this is very important when considering just the burden of long COVID on not just the patients, but the healthcare system and where we're going in the future with this. Regarding the qualitative work, several themes came out of this. I think it's important to note that what was discussed is primarily related to the perceptions of care that patients received prior to being seen in our consult clinic. But I do think that the themes are important for everyone to hear, including the public. And that is that patients are feeling like it's incredibly difficult to receive a diagnosis, a formal diagnosis of long COVID. They think that there's an overall lack of awareness of the condition. There's lack of resources. Their treatments that are being recommended are not in line with their goals. And all of this is really impacting how they can move forward. And so we are about to publish very soon some clinical considerations coming from this, and that is that we really do need to be taking a whole person approach and caring for these patients holistically, and educating the public like we're doing now with symposiums and seminars. And I think it's really important. And as, from a system standpoint, improving the coordination of care. And above all, we need to be listening to our patients and validating their experience and involving their family members and them and everybody as a team and working together. So as I mentioned, some of this data went towards clinical trial grants. We do have some upcoming studies that are really exciting. We have an acupuncture grant for pain that will be happening soon, that I'll be leading, the Energize trial, which Dr. Friedly will be leading. And then our rehab psychologists are also going to be continuing their work. And then a new pilot study that will be starting soon on stellate ganglion blocks for anosmia, so we're all very excited about this. Lots to come, and there is hope. Thank you.